The gynecological session, which I think was the first session that we had at the Oncology Forum this year, was very well attended, and we've had 5 extremely good speakers. One of them is an international expert on rare gynecological tumours. Gynecological cancers, interestingly, a large proportion, probably almost 50%, one could say, are rare tumours. Now, whether that's because morphologically they look different, because I think one can probably say in the future we might say that lung cancer will devolve into rare tumours, and it may be that we're just lucky that pathologically these look different. But we've for a long time not known what to do with some of our rare tumours because they are quite unusual. So as a community in the gynae cancer world in the UK, we have over the last 6 years worked to try and set up a database about the logging and acknowledgement of who has got what rare cancer and how we're currently managing them. So I'm busy setting up, it's a study called RANGO, which has all been approved and got ethics approval, and it's up and running, and we're now visiting all the gynecological cancer centres in the country, which are 44, to try and get every single one of them on board, because this really won't work very well if we only have 1 or 2 centres that will actually participate. We would like to know the entirety of the UK, and then we can put all of those patients' details anonymously onto a database. And that database then will be, over the years, we'll be able to collect that anonymous data and see what treatments we are giving to the 1 or 2 patients we might see with them. We'll be able to hopefully direct them into appropriate clinical trials when they come along. We'll be able to liaise internationally with other countries that are setting up similar things, such as in Australia and France, and ultimately improve the outcome for patients with those rare cancers, as well as hopefully doing some translational work. Part of the aspect of the whole RANGO database is actually to collect tissue from diagnosis, and Bart's tissue bank is storing that with the help of the gynae pathological community. The gynae pathologists have all clubbed together and got a space for us in that tissue bank, so that researchers in the future will be able to access that tissue and hopefully do some work to make things better. So it's a great it's a step forward. I hope it will also lead to maybe rarer tumour panels where we can actually put forward difficult cases as to what we might do for individual patients, at the same time as progressing some of the treatments.